Thank you. First of all, do you hear me well? Because
Yes.
I'm
Yes,
not
good.
sure. Yeah. Hello to everyone. My name is Teodora Koleva, and I'm the Executive Director of the Foundation for Social Change and Inclusion, or FSCI, in Bulgaria. My educational background is in psychology and child psychology. And in the past 15 years, I work with vulnerable groups, mainly young people who are living state care or alternative care, as well as kids from Roma community. I'm here with my colleague, Nikolai Zlatev. He will present himself also. He works for you, Nikki. You have to unmute your microphone.
Thank you. Yes, my name is Nikolai Zlatev. I'm from Bulgaria. I'm working in the foundation for over 10 years now. My educational background is psychology, psychodrama therapy, and for the last 15 years, I used to work with young people before in the institutions and alternative care, and now for 10 years and on with young people who are living alternative care.
No, thank you, Nikki. I will start with our presentation, giving a little bit about the context of organization and our aims and how we started. This is the wonderful faces of our organization. Yes, we're a Bulgarian NGO created in 2008. I started the organization together with Christopher Moult, who is a UK expert. And he's been working in Bulgaria since 2005. We keep working together with him, and even in the past 5 years, he created the same charity in UK in order to support the work on the Balkans. FSCI develops local capacity for tackling social inclusion and poverty. Also, a local team of experts lead and develop programs relevant to socio-economic and cultural context of the region here. Our mission is social development and integration of unprivileged individuals, groups, and communities in Bulgaria. We have 5 main objectives to cover as organization: to work for the social development of unprivileged individuals, groups, and communities, to assist in the process of social inclusion of unprivileged children, young people, and families, to endorse the human rights, and particular the rights of the children and young people, to encourage healthcare development and health promotion, and to encourage voluntary work. We have 3 main directions of work, and we'll share more about the House of Opportunity program, which we were able to spread across the Balkans. This is a first direction, is work with young people on the exit of alternative care, including foster care. We do accommodate young people who are living foster care also. Up to 2018, we run 7 projects in Bulgaria in different cities. We'll be able to create and develop local teams and work with local municipalities and stakeholders. After 2018, we reduced a little bit the work in Bulgaria, so we'll be able to spread more in the Balkans. Our second direction of work is early years education in vulnerable communities. This is how we call this program. And we work with Roma. We have only 1 community-based center in the Roma community. We are lucky to have a multi-ethnical team of professionals who deliver educational services related to early years education. We work with kids 3 to 5 years old before entering to the preschools of Bulgaria. Work in small group with the aim to creating and moderating interactions between kids, supporting the process of education and socialization, inspiring and maintaining motivation among parents for the long-term involvement of the children in the educational system of the country. And we do work long term with the children and families to reach their potential in education. Our third direction is the social entrepreneurship. We are very keen to develop and explore this area. And since 2011, FSCI has developed, piloted, and run system of 3 types of social entrepreneurship who are directly related with young alternative care leavers. We do have one atelier for handmade soaps. We call this Hope Soap. We had a restaurant until the COVID exploded, Hope Restaurant. And we had a car wash, which is not functioning now also, but were very good instruments to support young people who are on the entering on the social processes. Enabling access to the labor market for the young people who have grown up without parental support and people at risk of poverty, building and developing social and labor skills of vulnerable groups, increasing public awareness of the important social issues which our foundation tackles, developing social entrepreneurship as a sector in our country, and generating funds to support the social program of the organization. So now Nikki will share more about specifically the House of Opportunity and how we work in Bulgaria and across in the different countries, Serbia, Croatia, and Albania.
Yes, we call the project House of Opportunity Program. And usually we explain that this is a program, not just a shelter or a place that people can spend, young people can spend some time and just wait for the next service. So we believe that our service will be the last one. And we hope and we try our best, our service to be the last one that young people from alternative care get into. So before we started, we asked the questions, what happens with the abandoned children when they become adults? Because when a young person who grew in institution or alternative care at the age of 18 or 20, he or she has to do the transition to independent living by themselves mainly. And this is one of the most vulnerable periods of their life. One of the reasons, of course, is because of the state, the official government doesn't have any more obligation to continue the support them in any way because they are over 18, they are grown-up people, they are part of our society and community with all the rights that any grown-up person has. But young people in care usually don't have enough education. Of course, they don't have any or very small support from their families, biological or others. They don't have a place to go. They just need to leave the institution or the center, and they have to find a place to live by themselves, which is, as many of us can tell, it's very difficult for any one of us, especially for a young person who doesn't have many abilities. Of course, no network of acquaintances and friends, no job, no social skills. They are very naive. One of the reasons is because they're young. Another reason is because they grew up in a, let's say, a little bit different place, space compared to the other world. And of course, as many people, young people especially, have unrealistic ideas of their lives. So we thought that their chances are very, very small. And we thought what we can do to support them just to become adults. And as maybe many of you know, the reality for young people living alternative care is in Bulgaria, but I think in many other countries, is life on the street, of course, drugs, prostitution, etc. Because they're unprepared for independent living with poor education, no qualifications, and carrying the terrible consequence of life and in institution. This was when we started to think about the program, and in the beginning, the first years, because actually there wasn't the institutionalization started in Bulgaria at that time. So actually these were the perspectives for young people living institutions at that time. Of course, the perspectives for the young people were not bright. And what is the House Opportunity Program actually? Uh, the piloting and establishment of the House Opportunity Program in Bulgaria started in 2009. At that time, started the process of deinstitutionalization in Bulgaria, which as a country had many big isolated orphanages. The FSCI Bulgaria team with the UK experts conducted a survey related to the needs of the young state care leavers. According to the collected data and some international researches, this group was characterized as a group with high vulnerability towards involvement in high risks behavior, generally speaking. So the House Opportunity Program was designed on a local level to work as a preventive tool against risk behaviors such as involvement in crime groups, drug abuse, prostitution, sex trafficking, begging, recurrences in prison, exclusion from the labor market, etc. A network of observed homes, this is the, the term that we use in Bulgaria, observed home. This is actually halfway house, or it's called differently in many countries. So observed home is the Bulgarian translation of this word, according to the social policy of the country, for young people 18 up to 25 years old who are living in alternative care. This is a 2 years program, which includes individual needs assessments and individual development in the areas of, which means that we make this evaluation and this assessment of every single person, which of course is different from the needs of the other people in the group. So we try to make individual plan and to focus on housekeeping, health, social skills, education, employment, budgeting, trauma processing, and at the end, of course, the final goal is social adaptation, which means that this person could live by himself or herself after our service. A team of social workers and psychologists is available to each project and house. Of many people ask, can we do it without the professionals because they are grown-up people? But actually, our experience and knowledge shows that they need people who can support them in this way to independence. So each project accommodates up to 6 young people. Every young person can stay up to 2 years in the transitional program. We say up to 2 years because sometimes the period is shorter, and when we see and the young person realizes that he or she is ready to leave, we don't keep him or her in the service until the 2 years end, because we need to be flexible with this type of group. All running costs and food are covered by the program. This is because we need to give enough space for this for the young people to feel relaxed and actually really think about their future, their abilities, what their needs, and how they can meet them after they're leaving our program. Um, Internships are available for participants who are in the process of studying. Some of them, they didn't finish high school. Some of them didn't pass their final exams and they don't have a diploma for high school. Some of them would like to start going university. So this is a period of transition and realizing what actually they would like to do. Other opportunities given as well as courses, job opportunities, access to health and dental services, participation and activities, of course, job opportunities of the social enterprises that we run, access to psychotherapeutic support, annual participation in summer sports and educational camps, and others. So we try to make a lot of opportunities depending on their needs and the group and actually the goal of our service. So we can cover any aspect of it during the time. The program operates under a well-developed manual, which has been piloted and in function in Bulgaria, as well as in other Balkan countries as Albania, Croatia, and Serbia. Since the very beginning, the program developed a statistical case study database, which is used for study and research of main tendencies. The database is mechanism for monitoring of the process and the efficiency of the program. We try to keep data and to actually regularly put data in sheets and extract it afterwards, so we can be sure. first to see tendencies. Are we doing well? At what age and how much time they need to spend in our program so they can become independent. So we try to keep this data very tight and to be sure that it's up to date so we can use it properly. Local teams are supervised and supported by a team of professionals in the field of social work and psychotherapy, because we also believe that every team needs support from outside, not because, not only because we have experts, but because any people who are on the field, they need some support from people who are out of the picture, out of the main work. So the main results of the program in Bulgaria for the 10 years that we are operating here is about 80% of the participants improved their level of social skills. Above 65% of those who finish the program are developed their social skills to good level of independency, which basically means that they can take care of themselves by themselves without big support from other organization or people. About 65% have started new job. Above 20% of them keep their job workplace for more than 6 months. This is another indicator which shows something. It's not, sometimes they change job and they are stable, but it's good to know how long they can keep their one job. And 100% of the beneficiaries kept or improved their health condition, which are we very proud of this. Teddy, now back to you.
Yes, it's we have different um, we can extract different data from our database, but this picture is showing that most relevant period to be spent for a transition to independent living is 7 to 12 months, or this in brown, or a period of 19 to 24. I mean, young people who stay, because we have rules, we have constantly involved the young people in different activities in the organization, or support them with job offers, different things, we're training them. If the young person stays enough, like 7, 12 months, or 19 months, it's most probably they will manage with life afterwards. And this is the period which is average needed for those who wants to continue and try hard. And this is just a picture to show that we've covered more than 30 different places who provide alternative care, or other colleagues for nonprofits and work in the area, helping with the young people. This is only in Bulgaria, across the country, covering the young people who are outside of the alternative care, and who asked us for help. Because one of our criteria for work is motivation of the young person. We're not obligatory. We're working with those who wants to being part of our program.
So, and the next step was for FSCI to see if there are other countries in the region who have similar problems and can have the similar solutions. So in 2015 was created FSCI UK with the aim to extend the work of FSCI Bulgaria into the Balkans. In 2016, FSCI UK, with the Bulgarian team of experts, funded and replicated the House of Opportunity program. Actually, we started to search for partner organizations who are willing and have the heart and the same goals to help young people in this very specific age, because this is not children who can be educated and trained. These are grown-up people, and sometimes it's very difficult. People think that it's impossible to change their lives and to give them good opportunities. So we searched on the Balkans for partners who believe that they can make a change and actually they can support and help these young people to become citizens who are stable and decent. So FSCI's development program created a network of NGOs in the countries of Serbia, Croatia, Bosnia and Herzegovina, and Albania. Development of the services in partnerships on the Balkans under the concept of social franchise. In each country, hopes is multiplied. So the manual which we've created in Bulgaria actually answers the main, almost any question from the beginning of thinking, when you start thinking about how we can do a house of opportunity program until it runs, and after that, what kind of support we need, where should the house be placed, should it be a house or apartment, how many young people should be there, what kind of stuff we need, what kind of support we need, how we can search from support from our society. So all these things are structured in the manual, and we have very useful tool that we can, that everybody find that is very, very important and helpful. So the program, the 5 projects under the House Opportunity Program were established outside of Bulgaria. For these years until now, we have over 100 young people who are beneficiaries of the services. Nearly 60% have kept their job for more than 6 months, 1 year after leaving the House Opportunity. So we try to keep our statistics not only when they are in the program, but we try to follow up and to see how these young people develop after they leave, and did we achieve this goal to be the last service for young people leaving state care and any kind of alternative care. Over 90% are confident in their ability to be independent 1 year after leaving the House Opportunity again. And over 90% take care of their health adequately, which means that they don't get sick, or when they get sick, they know how to and where to find proper support and help. Of course, 1 year again after the House Opportunity program, when they leave, after they leave.
I will do the main conclusions from our experience in the past 10, 11 years. After 10 years of rolling out the program in Bulgaria and 5 years developing in different countries of the Balkans, the House of Opportunities operated under the same manual, which was adapted in some parts where it's needed according to the local policy, social policy especially, which, you know, we have differences from Serbia and not so much with Albania, but there are some differences, and we adopted the manual, but the main document is created. We keep seeing that highly needed, this program is highly needed for the group of young alternative care leavers across the Balkans. I mean, I know that the institutionalization is going on, and we close big orphanages and create small centers, small group centers, and foster care is developing, but still we've seen young people who are coming. Here in Bulgaria, there are, for example, we have a list of 4 people who are on the street now, and we're trying to support them and find somewhere to place them and help them. I mean, it's needed. It's a very effective instrument for preventing risk behaviors and promoting social inclusion and socialization of vulnerable young people. Giving this opportunity of 1 year doing the transition, many of those young people, they don't need to be on the street and, you know, do sex services or selling drugs or being part of the gangs or being to the prison, because they have somewhere enough time and space to develop and try different jobs. We give opportunities, not for one job and to say, oh, you failed. We give 1, 2, 3, 5 jobs if it's necessary, just to adapt the young person to real life. And in cohesion with the social entrepreneurship, the program has a key role in the process of giving opportunities to these unprivileged young people. We strongly believe that social entrepreneurship should be part of every house of opportunity, or at least regionally, to have a place where these young people, some of them, you know, they have their background being without parents and role models, are not very good in social skills. They not very good in talking and being on time. So they need a place where to train. And these social entrepreneurships are very good place to train the young people. And we thank you with Nikki for your time. I hope we were not so rushy, but if you have questions, of course, we are available.
Thank you, Theodora. Thank you, Nikolai, for sharing with us such an important work that you do for the past 10 years that I understood, and for sharing such a great results that you had with these very vulnerable young people that we are all, of course, responsible for them to approach them in the most responsible way we have. I was monitoring the chat during your presentation, and there are some comments I would like to read and some questions from the beginning. Let me see, just a second. So Tatiana was just saying hello to everybody, and she's saying that she's from Belarus, and she's working with the same question. For 10 years, about 50 young people have left the residential institution with our help and started to live in the society as other citizens. So I see that people are sharing also very good examples of their work. And also we have a Paul from Scotland. He said that they have legislation that allows care experienced young people to remain in care until 21. But sadly, too many are still leaving care at 16, 17, 18. Yeah. And there is a question from Lena, or Lena, I'm sorry if I'm pronouncing wrong. Can the program manual be shared for learning?
Well, it's part of our how to say, no. It's basically part when we start to work with an organization and start training the team there. This is the place where it's shared and developed through the 6 months of learning. It's about 100 pages. It's not just a book to be read.
Okay.
So,
yes.
Yeah.
Okay, thank you for the answer. And also there is Paul who said that he needs to leave at 1:30, but if anyone wants to discuss the situation in Scotland, then feel free to contact him. There is his email and his web page there, and he's asked if it would be possible for the slides to be shared after this event. He said that it would be really interesting to hear more about the House of Opportunity. The result sounds very promising. Well done. Thank you for today. And Paul, if you're still with us, we will be uploading the recording of this webinar. So you will have all the information there, and you could read all the materials.
If you like, we can send presentation of it also if it's
yes, thank you very much.
Yeah.
Yes, we will upload the PowerPoint presentation to a webinar page in the Child Hub where you registered as well. So you will be able to have it. I'm talking to the participants. You can send me Theodora and I will upload it. Yes. And okay, there is from Federico. He also said, if you want to know living care Italian system, you can write. So there is also email and webpage. And he said, congratulations about HOP program. So there is a lot of congratulations there and a lot of feedback. So I don't see any more questions, but if you have any kind of questions, please feel free to write it now in the chat, or if you want to speak, maybe you can also just write me in the chat and I will give you possibility to ask the questions or share your experience. Yes. Okay. There's a silence. I believe that people are writing during the presentation. So, okay, for the final note to the participants, also, if you want to have a certificate of attending today's webinar, you can have it. You need to write email to info@childhub.org. I will write it in the chat box. and you will receive the certificate of attendance to your email. Also, I would just like to take a minute just to share information. I believe that you all saw that the Child Hub is having a new design and a new colors. I hope that you like it. Also, please feel free to look at it and to stay with us also in the future, and to check out our newsletter for staying in touch with the new interesting webinars in the future. Teodora and Nikolai, I would just like to thank you for sharing your time with us today, for sharing your really great experience with us. It was really motivational. I hope that it was motivational for all the participants here today. Maybe do you have any kind of final note for today for the participants?
Just to thank you for the platform, and I just wrote to the organizations which gave their address. Maybe we could be in touch and support in the same area of work on the different projects. So thank you for the opportunity to share what we are doing, really.
Yes.
It's,
yes, thank you. I will just, for the final thing, share evaluation poll. So please give us a few seconds again of your time for clicking. And I see in the comments from Lina, we need a hub for Asia too. Yes, thank you, Lina, for this feedback. And feel free to invite all of your colleagues to stay in touch with the Child Hub. Also, there is a lot of materials there. There is webinars, there is the Child Hub Academy, so e-learning courses. I believe it is interesting for all of your, of course, experts in Asia too. Okay, so thank you very much to all of you for being with us, and I wish you all a nice rest of the day. Goodbye.
Bye.